Hello and welcome. Today we'll be discussing a challenging condition affecting the urinary system, bladder fistula. We'll explore what it is, how it develops, its impact, and the available treatments. This video aims to provide a comprehensive overview, helping you understand this complex condition. So, what causes a bladder fistula? Essentially, it's an abnormal connection between the bladder and another organ or surface. The most common causes involve obstetric complications, particularly prolonged and obstructed labor. Surgical procedures such as hysterectomies, cesarean sections, or surgeries involving the bowel or rectum can also lead to bladder fistulas. Other potential culprits include pelvic radiation therapy, inflammatory bowel disease like Crohn's disease, and, though rare, bladder cancer. Trauma to the pelvic region, such as from a car accident, can also contribute. Let's delve into the pathophysiology. A bladder fistula arises when there's damage or disruption to the tissues separating the bladder from adjacent organs or surfaces. This damage due to the breakdown of the normal anatomical barriers. Once this barrier is compromised, urine can leak through the abnormal opening, flowing into the connected organ, like the vagina in the case of a vesicovaginal fistula, or onto the skin if it's a vesicocutaneous fistula. This continuous leakage can inflammation, infection, and a range of debilitating symptoms. Epidemiologically, bladder fistulas are more prevalent in developing countries, largely due to limited access to skilled obstetric care. Prolonged and obstructed labor is a significant risk factor in these regions. While less common in developed countries with advanced medical facilities, bladder fistulas can still occur as complications of surgery, radiation therapy, or inflammatory bowel disease. Specific incidence rates vary widely depending on geographical location and the availability of healthcare resources. The signs and symptoms of a bladder fistula can be quite distressing. The most common symptom is continuous and uncontrollable leakage of urine. This leakage can occur through the vagina, rectum, or onto the skin, depending on the fistula's location. Other symptoms may include recurrent urinary tract infections, abdominal pain, vaginal or rectal irritation, and skin breakdown in the affected area. The psychological impact of these symptoms can be profound, leading to social isolation, depression, and a significant decline in quality of life. Diagnosing a bladder fistula typically involves a combination of physical examination and imaging studies. A physical examination may reveal urine leakage from an abnormal opening. Diagnostic tests include cystoscopy, where a small camera is inserted into the bladder to visualize the fistula. Imaging techniques like a cystogram, which involves injecting dye into the bladder and taking X-rays, or a CT scan can also help identify the location and size of the fistula. A dye test, where a dye is instilled into the bladder and observed for leakage through the vagina, can also confirm the diagnosis. Bladder fistulas are often classified based on their location and the organs they connect. A vesicovaginal fistula, connecting the bladder and vagina, is the most common type. Vesicoder fistulas connect the bladder and uterus. Vesicocutaneous fistulas create an opening between the bladder and the skin, often after surgery. Rectovesical fistulas connect the bladder and rectum. The classification helps guide treatment planning and determines the complexity of the repair. Treatment for bladder fistulas primarily involves surgical repair. The specific surgical approach depends on the size, location, and complexity of the fistula. Small fistulas may be repaired through a transurethral approach, using instruments inserted through the urethra. Larger or more complex fistulas may require open surgery, involving an abdominal incision. In some cases, a tissue flap from a nearby muscle may be used to reinforce the repair. Before surgery, any underlying infections should be treated. A bladder catheter is typically placed after surgery to allow the bladder to heal. Preventing bladder fistulas focuses on addressing the underlying causes. In developing countries, improving access to skilled obstetric care and emergency cesarean sections is crucial to prevent obstetric fistulas. Careful surgical technique during pelvic surgeries and minimizing radiation exposure can reduce the risk of iatrogenic fistulas. Managing inflammatory bowel disease effectively can also help prevent fistula formation. Promoting awareness about these risk factors is key to preventing this debilitating condition. The prognosis for bladder fistula repair is generally good, with high success rates achieved through surgical intervention. However, the outcome depends on factors such as the size and location of the fistula, the patient's overall health, and the surgeon's experience. Recent research is focusing on minimally invasive surgical techniques, such as robotic-assisted surgery, to improve outcomes and reduce recovery time. Additionally, studies are exploring the use of biological materials to enhance tissue healing and prevent recurrence. Continued research and advancements in surgical techniques offer hope for improved outcomes and a better quality of life for individuals affected by bladder fistulas.